about to see is graphic. If at any time you feel dizzy or lightheaded, close your eyes and place your head between your knees. What you're about to see is an example of a trauma patient coming into the ER after having been involved in a motor vehicle accident. This was caused by texting while driving.
What do we have here? We have a 70-year-old female unrestrained passenger from the NBA. She was ejected from the vehicle. She has her own breath sounds. She's breathing on her own. She has a pulse, right leg is broken, and she has multiple lacerations all over her body.
All right, let's get these clothes off so we can see all of our injuries. We need to put her on the monitor and get 2 large 4 IVs so we can start our fluids.
This is a 16-penny nail, and this is a 16-gauge IV needle. This is what we will put into both of your arms to allow us to give you fluid and blood as fast as possible.
Breath sounds getting worse.
Let's try to deflate the ill using the needle decompression.
Trauma accidents usually injure the lungs, causing them to collapse. We will place the needle below the lung space in an attempt to expand the lung.
Lung sounds aren't improving. Let's try a chest tube. Let's get a 40 French chest tube.
This is a 40 French chest tube. It's as big as a garden hose. We will place it into your chest. This way, the blood that has filled the chest can be removed.
Breath sounds are improving and oxygenation is coming up.
Do we need to splint this leg and stabilize her head?
Yes, let's get this leg stabilized. All right, check for femoral pulses on both sides and wrap that sheet around to get her hip stabilized.
We will place your leg in a splint and force it straight to prevent any other injuries or complications from happening. The hip fractures make you lose tremendous amount of blood. We need to stabilize the hip to prevent further injury or loss of blood.
We need to see how our kidneys are functioning. Let's get a Foley catheter and get an ABG tube.
This is a Foley catheter. We will place it into your bladder to monitor the amount of urine your kidneys are producing. The respiratory therapist is sticking a needle into the artery to get an arterial blood so that we can check the patient's oxygen level and breathing and metabolic status. That can be painful.
Blood pressure is dropping. We have normal saline infused. You want to start to infuse blood?
Good idea. Let's call the lab and get O-neg blood down ASAP. We need to get it as fast as possible. Put it in the rapid infuser.
With any kind of trauma patient, blood loss is a big deal. We will get blood for you and give it to you as fast as possible. With a rapid infuser, a bag of blood can be forced into your body within 6 minutes. With a leg fracture, you can lose up to 2 liters of blood.
Blood pressure isn't coming up. I'm getting faint pulse here.
She's asystole on the monitor. We lost the heartbeat.
All right, let's open the crash cart. We need intubate. Let's start CPR.
This is an endotracheal tube. The respiratory therapist will place this into your mouth and into your lungs. It's not an easy procedure. Teeth can break and tongues and lips can be cut. This will allow us to hook you up to a machine so that it can breathe for you. And if we need to do CPR, we will press on your chest with a lot of force, sometimes enough to crack your ribs.
First round of meds are in. Let's check for a rhythm.
They look like they're still in VFib.
All right, let's get ready to shock.
All right, everybody stand clear. Is everybody clear?
Clear.
All right, shocking now.
heart is beating, but not like it should. It needs an electric shock to restart the heart. The shock is strong enough to lift the patient off the stretcher.
Looks like she's flatlined again. Let's continue compressions and meds.
This process of CPR, shocking, and giving the patient medications can be done until there is nothing else we can do to bring the patient back to life.
We've been working on this girl for over an hour. Do we have a pulse?
No call. She's still ACE is still on the monitor.
All right, does anyone have any other suggestions of what we can do? All right, we can call it. Time of death is 10:15.
At this point, the medical staff has done everything that they could to revive the patient. Now the doctor and the nurse have to go to the parents of the patient and let them know that their child will not be coming home tonight. Meanwhile, the coroner has to go to the patient's parents of the other car and let them know that all 4 of their kids will not be coming home as well. Imagine us having to look your parents in the face and let them know that you won't be coming home tonight. This was all caused by texting while driving.
Medical personnel have done a great job creating this scenario for y'all. That's what this was a scenario. But this really happens. I'm the fire chief and the deputy coroner. What I'm going to be talking to you about today is real. My preparation for today was simply to get dressed and come here, because what I'm sharing with you, I carry with me every day and every night, because it happened. I was there. Let me paint the picture for you. It's a pretty Thursday summer afternoon. 2 girls, 14 and 15, are bored. They talked one of them's grandmother into letting them take her car and go ride dirt bikes. The girl driving looks down to read the text she just got and loses control of the car. They wreck on a dirt bike. They're not sure where they're at. One girl is thrown from the car and she's laying in the middle of the road. She's able to call 911 from her cell phone, but she can't tell 911 where she's at. All she knows is she's on a dirt road somewhere in Wilcox County. 911 dispatches firefighters, ambulances, deputy sheriffs, police, and we start riding dirt roads in a grid pattern for 10 minutes, 15 minutes. We've got somebody at the sheriff's office marking off roads. Somebody's already been here. Somebody's already been here on the map. 20 minutes goes by. This young girl's still laying in the road. 20 minutes, 30 minutes, 35 minutes. After 40 minutes, the girl laying in the road was found. The ambulance picks her up. Just like the girl in the scenario, her leg is broken and has to be splinted. The ambulance takes her to the hospital. Unlike this scenario, she lives. But she lives carrying the memory every day of her 14-year-old friend who didn't make it out of that car. I got this scar on my arm, getting that 14-year-old girl out of that car. Every day when I see this, it reminds me of that beautiful 14-year-old girl whose body I pulled out of that car because that text was more important than maintaining control of that car. It happened. I was there. I pulled her body out of that